for the last video, I'm going to be demonstrating the Inhalant route of medication. For this, I am going to be using a bottle that you've seen previously in the other videos. We're just going to imagine that there is a bottom piece here. That would be the mouthpiece of the Inhalant, and that will give some sort of like space between my patient and the bottle. So we're just going to imagine that there is this mouthpiece here. If you see this space, we are doing the closed mouth demonstration for him for this inhaler. So this little space here will be, this invisible space will be representing the mouthpiece that will be inside of his mouth. So I will come to the MAR and see that I have a patient, Cam the Camel, born April 1st, 2001, is supposed to be getting 2 pumps of his inhaler. So I would go into the medicine cart and make sure that I select the correct bottle, which is the one that is labeled for him with his name and his date of birth and the time and the dosage. So it also says here, as well as on the MAR, that this is for Cam the Camel, born April 1st, 2001, and he's supposed to get his medication now, 2 pumps for this inhaler. So I will then make sure I wash my hands and apply my gloves, and I will take this bottle to his room or to where he is currently at the moment, dining hall, wherever it is. So to his room, and he will come out and he will verify who he is. And he will say he is Cam the Camel, born April 1st, 2001. I will then shake this for 8 to 10 seconds, explaining that it is time for him to get 2 pumps of his inhaler. And I will explain that he needs to close his mouth around the mouthpiece here and inhale simultaneously as he presses the inhaler button, this top button here. Simultaneously breathe in as the medication is being dispensed. So I will shake it here, take off the mouth guard. I will hold it up here to his mouth for him. And then at the count of 3, because he is unable to hold it himself, I'm going to press down and he will inhale simultaneously. So we will shake. He will hold said mouthpiece in his mouth. 1, 2, and 3. And he will inhale. Hold for 10 seconds if possible, and slowly exhale. So the medication can be administered to the lungs for a lot of time. And then we are going to go again, shake a couple of times, a couple seconds, make sure that medication is really good and mixed and ready to be administered again. He will have it placed in his mouth again at the count of 3. 1, 2, and 3. And he will inhale, hold for 10 seconds or so if possible, and then slowly exhale afterwards. I will then clean the mouthpiece off and recap it, replace the cap at the end. I will then return medication back to the cart, dispose of my gloves, wash my hands, and document the date and the time and the medication that was given to the right patient. And any symptoms or any unusual state or condition of the patient if asked in the MAR.